It is Friday, June 5th. Joe Delaronio Jets. Welcome to the COVID-19 Task Force Daily Update. And as I said, it is Friday. It has been a busy week, an important week here in Kahnawake. Lloyd Phillips, the Commissioner of Public Safety, will be here in a little while. Also coming up today, we have an interesting video on inspections. But before we do that, we'd like to introduce the Executive Director of the Kahnawake Memorial Hospital Centre, who will bring us our first update, and that is Lisa Westaway. Lisa?
Thank you. I have a quick update today. Lloyd's going to speak to you a little bit more about the week, a summary of the week that has happened, but I just want to give you a little bit of information about what's been happening around us in Quebec and also here in Kahnawake. So first, what we'd like to show you, this is from the Quebec.ca site, and if you go to that website, you do get a lot of information about what's happening around us. So firstly, this table is just to demonstrate death rates and how it's decreased quite significantly over the past few weeks. So we'll start maybe with April 27th. And if you look at the green line, because what I want to focus on are number of deaths that have happened outside of long-term care facilities. So these are predominantly 70, 80, 90-year-olds and up. And so the death rate, the number of deaths that week of the 27th of April was at 69. And week by week, what we can see is a continuous decrease in the death rate, no matter where people are living, but in particular, we're focusing today on people who are living at home, so those around us and that are not in long-term care facilities. If we go all the way to the week of the 1st of June, for the green, we see that there were 11 deaths. So again, we just want to focus on that because we had spoken about that as being one of our indicators for our reopening strategy, and so we wanted to demonstrate that there has significantly been a decrease in death. What is important to add to that is the R effective rate. So I spoke a little bit about it this morning on K103. R effective, if you remember, Dr. Gauthier explained that. That's the amount of people that can be infected from one person who has the virus. And when we first started back in March, before we implemented many measures, we were above 5 in our effective rate, meaning that one person would potentially infect up to 5 people, and that would multiply as you would move along. And that's why we did have to close everything down, because the idea was that we could not have that many people sick at once, because we wouldn't be able to care for them in the hospitals, we wouldn't have enough hospital beds, and we wouldn't be able to control the amount of death. So one of the criteria for the reopening strategy was to have an R effective rate under 1. We knew that we were just above 1 a few weeks back, and we had to wait for INSPQ to recalculate the R effective rate. It's a calculation that we can't do on our own. So I wanted to let you know that the R effective rate is hovering under 1, and it has been for a couple of weeks, although we just got the information recently. So that's really important, because what that tells us is that if we maintain the measures of social distancing, our hygiene measures, all of the preventative measures that we have in place in business and at home for us as individuals, that again, as we've been saying, that will be very important in ensuring that we don't transmit the virus to large groups of people over time. And so we need to continue to keep in place these measures over the long term in order to keep that R effective rate under 1. So if we do get the virus, we know that we will not be transmitting it as little as possible to those around us. So I also wanted to talk about the testing site, because that is another variable that we look at when trying to make decisions about whether we need to pull back or if we want to compare before or after the reopening strategy of phase 1. And so testing is really important. The amount of people who come for testing is very important. So just to remind you, all of the businesses have a strategy in place where their employees must self-monitor and fill out a health check before coming into work. And if they have any COVID-related symptoms, they are instructed to contact the testing site, and they will be tested. So it's really important for you to know that that is in place, that strategy, because we want to make sure to test anybody who has symptoms and to contain the virus as much as possible. But we continue to tell you, to general population, that if you have COVID-related symptoms, to call independently to be tested. So over the last week, we've had less than 7 people tested. This is at an all-time low. We can assume that that means that people are not exhibiting COVID-related symptoms. We don't know. We can't say that for sure. But based on the decrease that we saw with the health check, it makes sense that, and based on the limited number of active positive cases in Kahnawake, that makes sense that we're starting to really see a decrease in the amount of people who are coming in to be tested. So again, we're going to continue to follow that on a regular basis, because that gives us an indication of what's happening in the community. So I just wanted to touch a little bit upon the next steps. What are we doing as a task force to be able to really compare what's happening in the community before and after the reopening? So Lloyd will talk a little bit more about all the elements outside of health, but as for the health perspective, as we had mentioned, we're going to be redoing the health check. So that means that we'll be calling each individual household and asking you questions about COVID-related symptoms. It's really important. That's why we're starting to talk about it now. We're going to start those phone calls after 14 days of reopening. We know that symptoms could appear 7 to 14 days after contact. And so we urge anybody who has symptoms to come in and be tested. This is a cornerstone of a successful reopening. Remember the social or the physical distancing, the identification of symptoms, the quick testing ability, and the contact tracing. And so it's really important for all of us to work together to ensure that if we have COVID-related symptoms, that we get tested. So again, I just wanted to thank you for your patience this week. It's been a difficult, emotional week for all of us. It's scary, and we all fear this. We all feel these emotions as we go through the week, and I guess the video that we're going to show will give you a better idea of what the inspectors are doing, and then Lloyd will talk a little bit about the week that was. Thank you.
All right, thank you very much, Lisa. Just before we get to the video, and I'll explain that in a moment, I just wanted to, I know we have people watching from various communities all over the place, but for people in Kahnawake right now, just to let you know that the water advisory that had been put out there, everything's okay. We had been asking for everybody to reduce their consumption of water. There was a bit of a problem at the filtration plant. It's been taken care of. Everything's back to normal. All right, earlier in the week, on Monday as a matter of fact, businesses reopened in Kahnawake. We talked a lot about the inspections and the work that went into it. And one of the best things we could do is actually show you what it is all about. And one of our inspectors, Iokennoron, will take us through a day of inspections.
Hello, my name is Iokennoron McComber, Kahnawake Labour Office, COVID-19 Task Force Inspector. I'm about to do the inspection for K103. Follow me, please. I got pretty jacked pinkies from doing this. Iokennoron McComber, Kahnawake Labour Office, COVID-19 Task Force Inspector. Wave to the people. Yes. You received the package detailing all that stuff about self-checking and everything. Yeah, the one you have to fill it out every day. Every day you have to take the time to fill it out every day.
Once you reopen.
Once you reopen, if you pass.
Okay.
I cover all the stuff from the screening process for the employees to your square footage and how many people can be in the building at a time. That's all dependent on the establishment owner. If they're allowed 10 and they only want 6, clearly write it. We go over the physical distancing, make sure it's maintained at all times. If the establishment has a directional flow, it needs to be clearly outlined on the floor in arrows. People are waiting for nice signs, but for the purpose of inspection, if you have tape on the floor, that's more than acceptable. It's to give me photographic evidence that you're doing the measures. All right, how many employees are actually in the building once running
Once
it?
we reopen,
Let us walk through.
so there's one here, one there.
Okay,
Every office has one person.
okay.
So 1, 2, 3, 4, 5 people.
Everybody goes through the same thing. Your sanitizer has to be clearly visible. You have to have them spaced out all over the place where at the most convenient spots. Your bathroom has to be cleaned after each use. Disinfected shared equipment at all times. Your waste products, you can't have a lid on your garbage can. No lids because I already washed my paws. I'm gonna have to wash them again. He's gonna get it on video. Because if I blow my nose or do whatever,
Okay.
I have to touch it.
Okay.
So that has to be sanitized now because even though I wash my paws anyways, it still has to be sanitized.
Okay.
So all the lids on everything has to be taken off. It's also for mask safety. When you take your mask off, you just drop it right in the receptacle. We're asking for plexiglass barriers, but if you don't have plexiglass, plastic will do on a frame. Anything that'll prevent somebody from speaking moistly in that area. The plexiglass doesn't have to be all the way up to the ceiling, just in that speaking area. When it's impossible to maintain 2-meter distance, worker and customer each must wear a mask. When it's impossible, you have to educate your staff on the proper mask and glove wear and the criteria when in use. And you got to make sure that your establishment has the COVID-19 related distancing signs, precautionary measures, plaster them all over. Make it redundant. Okay, clean and disinfect shared equipment before and after each use. Is there any shared equipment?
Just the photocopier.
Okay, that's gonna have to be
Yeah.
done after every use. Just make it a habit. What I'm recommending for a lot of the businesses is to make a punch list. This way everybody's accountable, like, okay, you use the photocopier, sign off on it. Did you disinfect it? Yes, sign your name. It's just to help keep everybody accountable and not have people not get complacent. Really, each business is kind of unique, even though it might be the same 20 by 20 structure, different, their counter space is different, their setup is different. They might have a soda machine. It'll all depend on the place. Everyone is different. All the commonly touched areas, like the water cooler, that's an often neglected element that people don't think about. The phone, you should have a hand sanitizer close to the phone or wipes. Any computer has to be wiped. Microwave, kettle, whatever people touch, it has to be sanitized, it has to be cleaned. We're trying to instill in employees that the sanitizer is there. You clean it, take out what you got to take out, put it back, and then clean it again. Okay, so we're just gonna wait right now for Paul to be finished. I'm going to glove up. We're gonna check out Mr. Grafe's office. I properly gloved up, just in case. Paul, can you run us through your protocols on your personal workspace? I don't want to touch anything or.
So the protocol in here for the news studio that I've been enacting since coming back to work as the pandemic began, I guess on March 16th, because that was the first day back, was immediately I wipe down every surface that we use that we never did before, which meant cleaning each key on the soundboard, on the keyboards. We use 2 computers. The mouse is the hardest thing to do without messing up your computer and the way things are. The mic socks, I made sure that I have my own and that the other announcer, Jeremy Zaffron, has his own, so we keep it over there. And we take those off and leave the mic. And then we clean the microphone, the stands, pretty much everything that we touch. We have our own chairs even.
Good.
We've put that into place.
Excellent.
And I still clean my chair every morning. So when I get in, I use my disinfectant spray all over the place. We have rags that are one use, and then I can bring these home and actually wash them in the washing machine and then reuse them several times. So we're trying to save the environment a little bit as well, not just using the wipes, although some people use those. When Jeremy gets in, when we have the crossover about how things are going in the news department and the discussions that we have, he sits in his chair and is at least 6 feet away from me so that we can have the conversation. And I take off my mic sock so that he can put his on.
Awesome.
And he does all his cleaning right in front of me before he starts his shift. So I've been coming in a good 15-20 minutes earlier every day in order to make sure that I do that. In fact, for Monday mornings, often I'll come in on a Sunday afternoon so that I don't have to wake up extra early on a Monday.
All right,
and
good
make
stuff.
sure that it's done. The headphones get cleaned. Anything you can think of, the backs, the sides of the computer, because we move those.
What about the button on that?
It's funny that you should say that, because we only put this in here the other day. The air conditioning wasn't working well, and the last couple of mornings I wiped the button on that as well. I redo the door handles.
Okay.
Even though we have a cleaning crew that comes in here 2 or 3 times a week, I make sure that we clean the door handles, and I even will go into the kitchen, do the fridge, the toaster, the microwave, all of those things, and the insides of the handles as well.
All right, awesome, good stuff. You will be subject to spot inspections by one of the 7 inspectors. We're not going to tell you when. I'm not even giving my schedule to the other inspectors because it'll breed complacency. So one day it could just be me. The next day it could be all 7 of us at different times.
Okay.
Just to keep you guys on your toes and make sure everything's up to standards. And if you have any questions, we could possibly answer instead of people calling the task force. What if I do this? We've dealt with enough people that we can answer them to the best of our abilities, I guess.
Okay. No problem.
Okay, so I'm gonna grab from the palm. You shouldn't wear a watch, but it's stuck right now. Okay, now I'm gonna take my other finger and weasel it underneath. Right in. Make sure you get under the nails. Okay, now you remember Big Trouble in Little China? The old man where he's got the long pinky nails and he does the pinky trick? Yeah, this one's washable, so I'm gonna keep it. I spent like $30 on it. On behalf of the Kahnawake Labor Office, we care, Kahnawake. Thank you.
Thank you, Yug. That's a very informative video, and it shows a outline of basically the extent of the inspections that take place. And sure, this one was at K103. I said, but the same process, applies across the board. Obviously, when we're talking about businesses and moving forward, it also include the additional businesses that will open in phase 2, as well as other community organizations. So that just gives you an idea of the extent of the work that's being done, to maintain people safe as possible, and make sure people are following the proper safety standards that were set forth by the task force. I just wanted to retouch on something I discussed earlier this week regarding the approach that the task force had done regarding the whole business reopening. And I was also additionally inspired by Geraldine Stand-Up's comments, and kind of put a little more things into perspective and on the direction that we were already heading. But it certainly helped solidify it. I know, talking about a more holistic approach moving forward. Looking at the whole, the physical, spiritual, mental, and emotional well-being of our community. And as I said last week or during the week, is that obviously in the beginning we were focusing on the physical well-being. The COVID virus was our main concern, and that was the reason why we had to take all these strong measures moving forward, and that are largely still in place today. So that was generally the main concern. But as things evolved, and seeing the impacts of the measures, basically having people in lockdown, staying home, essential services only, all these things that were put into place obviously had an impact on people's, spiritual well-being, their social well-being, not being able to socialize with individuals and the way that people are accustomed to it, start having impact on their emotions and having impact on their mental well-being. So these are some of the things that we have to take into consideration as things have evolved over the duration of the pandemic. Obviously we're not completely through it, but things are definitely looking better as we move forward. We also have to maintain our hypervigilance, in terms of taking the measures necessary to keep ourselves safe, mainly being, and they said 100 times already, the social distancing and hand cleaning are the backbones and the pillars of keeping ourselves safe. That was some of the justification in terms of engaging phase one. Is also, for the people who are employed, people who want to get back to work, also, they felt that they need to have that, obviously that security of an income, as well as having that ability to socialize with your co-workers and so on. So it wasn't simply just an economic decision. It was a whole holistic, human decision, taking all people's emotions and spiritual well-being and so on into consideration. And that's going to be the general trend moving forward, and the way we want to look at, because we look at phase two of openings, which I'll say right now, there is no tentative date set for that. That's going to be done after we have a chance to fully assess where we are today, and as well as after the health check. So it's going to be some time down the road. But when we get there, I mean, that's the same concept moving forward. It's like it's yes, opening a business is an economic decision. But that economic decision to open a restaurant, for example, is also a social decision, and whereas people have the ability now, if a restaurant is open, I can go there with my wife or with a family member that lives in the same household with you, and being able to get out and have a nice meal and have a drink or enjoy yourself. So that also helps people's sense of normalcy. It helps their emotional well-being. So that's the way we look at things as we go forward, and as we get closer, obviously we'll get more information on that. But right now, what we're doing is we're pulling together whatever the regulations are in terms of safety mechanisms for all these industries that are not open yet, and making sure that it's clear what are the requirements, and have people prepare themselves for that eventual opening. And that will help expedite the entire process once we feel it's safe to take that next step. But like I said, at this point in time, there is no set date. The same similar scenario applies for the community organizations in the community who are still under essential services only, and they are functioning largely from remote locations, using Zoom and Skype and other types of conference calling and stuff to function as best as they possibly can. No, the community is functioning, it is managing, but it is still operating under the essential services. Because it's equally as important in terms of from a health perspective, having people return back into an office setting is equally as risky as opening businesses, and perhaps even more risky, because one of the rules that we use in terms of determining whether or not somebody had exposure to somebody who had the virus is if somebody's within 6 feet for longer than 10 minutes, and then they're considered to be somebody who has potential exposure. But if it's further than 6 feet in less than 10 minutes, no, there is no very minimal chance of transmission of virus. So if you're looking at a retail establishment, for example, so somebody comes in, they pick up their product, they pay for it and they leave. Maybe they're in the store or in close proximity to somebody for maybe a couple of minutes, 2-3 minutes to get what they got to get and get out of the store, maybe 5 minutes at the utmost. But when you're looking at an office setting where people are working in the same environment, in the same rooms and such, you're going to be there for some time, hours, with somebody in the same room. So if somebody is sick, even if you're maintaining that distancing and not through the work environment, you may be passing each other often in the hallways or in your workspace. So there is a risk there as well. So that's why we want to take it slow, because phase 1, was part of business, but then phase 2 is additional business, but also looking at how the organizations evolve back into a more normal state of operations. So, there's all these variables that have to be weighed, and we have to make sure that when people go back to work, who work for the community organizations, that they do so in a safe manner. And likely people will have to remain home and working from home for a longer period, probably throughout the summer. For those who are highly functioning from home on a computer and so on, that may be the new norm for them for some time. But each organization has been tasked with the responsibility to come up with their own plans on how they see themselves moving forward from when the essential service is lifted, how they see themselves gradually returning back to a state of normalcy. So there is, again, a lot of things to consider as we move forward. But obviously, this week was a significant week. With the phase 1 of business opening, and which was the retail sector. And obviously, we understand and acknowledge that a large part of the retail sector is the tobacco industry in our community. And Monday was a very hectic day. There was a major influx of people wanting to purchase tobacco products. We understand that. We are anticipating an influx. But to be quite honest, I didn't anticipate it to be as much as it was, but it was managed by the inspectors. The peacekeepers got involved, and as well as some of the owners of the stores stepped up to get involved to ensure that it was managed as effectively as possible. And I know there was some videos out there on showing some of, I guess, what appeared to be chaos at some areas in the community. And the anxiety and some of the fear and anger that people expressed. And believe me, myself and the task force shared that fear and anxiety and looked at that very closely. And I'll tell you, if Tuesday increased the much better, it was the hecticness and the chaos decreased to a minimum, and Wednesday was even better. But if Tuesday would have looked like Monday, definitely the task force would have had to step in and maybe look at the possibility of rolling things back. But I'm glad to see that measures were put into place and people took it seriously and things were managed and we didn't have to roll things back because things were still being able to be handled in a safe manner. Even though the traffic in certain situations was out of hand, but when it came in terms of the virus, in terms of safety measures, plexiglass, hand washing, masks as required, those things were in place and those things worked out. At the end of the day, they worked out very well. So we did get the feedback, from the inspectors, as you see in the video was one of them. But we had a report this morning on what happened Monday, but also what happened Tuesday, to Friday, and they really had given a very positive feedback, to the task force that things are going very well, that the people they spoke to and have feeling much more comfortable as the store owner, as the employee of the store owners. They feel that people are really starting to understand the measures, get more accustomed to what's again the new reality that we live in, and they are quite happy with the response they received from the people that they spoke to. And they also been doing spot checks. Just because somebody was inspected prior to opening, they have done repeated spot checks to ensure that people are abiding by the measures. And they have reported back that there has been no major issues that they had encountered. So again, hats off to everybody who's involved, and hats off to the business owners, and certainly the inspectors. I appreciate them because they're the guys who are really on the front line, feeding information back to the task force. So that's really important. As well as, they also reported back. They spoke to several employees of the retail establishments, and some of these employees were nervous to return to work. But once they got to work and then they seen the safety mechanisms and they seen the way things were being laid out, many of them felt much more comfortable, in the new work environment. So we've been monitoring all that as well. So we've seen some of the recommendations that people had put out there in terms of additional safety measures. And actually, it was discussed today at a full task force meeting, and we're going to be having some directives that's going to be recommending a few things. It's going to be recommending that masks become mandatory for anybody entering your business establishment, and as well as for people to have, at the busier stores especially, to have a doorman outside to ensure that everybody going into the building is going to have their hand washed, and also making sure that the number of people in the building is only the number who has been authorized. And that could be anywhere between 1 to 3 people, depending on the size of the building. So those are going to be some things that's going to be coming down the line. So I just wanted to relay that information to you. We also received reports from the Kahnawake peacekeepers, who also fielded many calls, over the week, and have seen a major decrease, from Monday to Tuesday to today in the number of calls, people expressing concerns and such. So they also had reported that they are. Things are being well managed. They feel that things are manageable in the community, that anybody who's not supposed to be here for valid reasons, that they're able to manage that, and anybody who is not in line or here for a good reason is asked to leave. So they're really on top of their game. They have extra guys, officers, on the road as well. So with that said, we had a good discussion today at the task force, and we felt that it was 5 days. We'll give it a weekend to run through and see how things are playing out. But right now, we think things are settled down. Things are being managed in an effective or an appropriate way. So we'll see what happens, by Monday, and then we'll do a much more, additional assessment of where things are going. Also, this week, there was a clarification that was issued regarding the non-locals in the community, which was clarified to mean basically family members of Iokennoron can come to the community to visit family. That was I know caused some concerns early on in the week, but that was the intent of it, because there are many issues that that we have to deal with, and it comes to myself or the task force, during the week, and this was going on since near the beginning of the pandemic. Such things as custody issues. One parent lives in the community, the other parent does not live in the community, but they haven't seen their child in a couple of months. Now they want to visit. Grandparents, same thing. One may not live in the community but want to come visit, and so on and so forth. So there's many different scenarios along those lines that I honestly never thought I would have to deal with, in my role. But dealing with child custody issues and trying to find a way to ensure people's spiritual, mental, and emotional well-being is taken care of equally as the virus, the holistic approach. So we have to look at how can we accommodate people's needs in a time of crisis, and obviously keeping families apart is not my goal. Is to try to get people together to visit safely as quickly as possible. So that was some of that's the rationale behind it, because those are some things that maybe we don't say enough or we don't explain enough on occasion. But there was a lot more to it behind that directive than maybe was obvious. So that's something that I just wanted to relate to the community. And one other thing that we dealt with a few times this week was regarding the Ironworkers and crossing the border between obviously the U.S. and Canada. We emphasize the fact that a lot of that criteria there is not a Kahnawake necessarily criteria. What we have is from up until at least June 21st, that is a Canadian law, no international law. The Quarantine Act is in effect. So if you do cross the border into the U.S. and you do come back, you are subject to the Canadian Quarantine Act, in which you are subject to quarantine for 14 days. Until that is lifted, I mean, that's something that we think is extremely important as well. But no, the core of it is with the Quarantine Act. Hopefully, as things evolve over the next few weeks, now that may change. But again, we're watching that on a day-to-day, week-to-week basis. Now, one thing I just want to touch on a couple of points, before I end off, and this may be reflection a little bit, because although we are no means at the end of the pandemic, we are seeing a definite evolution. But just to keep in mind, we have what happened in March when the declaration came out that it's a global pandemic, and a lot of measures kicked in fast. It was like having a freight train, that was coming right at us, and nobody really knew what was happening. Nobody really knew what the impacts were, not just in Kahnawake, but across the world. So what the reaction was, obviously, is shelter in place, close things down, isolate yourselves as best you possibly can, and let's see what happens. And things, and that's exactly what took place. And throughout early March, and the numbers were very low. Then by the time you hit mid-March into later March, that's when we start seeing a lot of infection rates. So we had people starting to die, and then in April again it kept going, and it was around mid-April where we seen that leveling off, and that diagram that was shown earlier kind of illustrates that as well. It kind of peaked for a couple of weeks where it was consistent, but consistent at a high level, and then it gradually start decreasing. So from the beginning, we always talked about that curve and that wave. That's exactly what happened. It started off very, very low. It went up. It peaked, and now it's on its downward decline. And even from last week, the last week of May to the first week of June, the numbers are continuing to go on a downward trajectory, which is very good. And it's very positive, in terms of giving confidence, to the task force and confidence to society as a whole. But again, we have to maintain those measures, and as long as we remain safe and we remain vigilant, those numbers have a high probability of staying low. If people stop social distancing and stop following the measures and stop being safe, and then obviously, it's out of anybody's hands at that point. But again, that's where it's really important about the personal responsibility. The virus is not going to go away. We said this before. We're in this for the long haul. Until there's a vaccine, or at least a very effective treatment for this virus, we're going to have to continue these measures. Right now, the numbers are getting manageable. They're getting much lower in Quebec and Montreal and such, and obviously always been low in our community. So we're feeling more comfortable, but we also got to be, again, like I said, we have to maintain that vigilance, because even though we open things up, we're feeling confident, we're feeling good. If we would have waited another week or another 2 weeks, another 3 weeks, the end result would have been the same as we have now. So I just want to maybe end off by mentioning that by holding off longer, which I know a lot of people felt that certain things should have waited. The numbers are on that trajectory that we really want to see them. So again, moving forward, we're confident in how we're moving. We're confident where things are going. And when we feel confident, we will engage the second phase of the reopening, where we will engage with the organizations and to ensure that, again, everything is done in a safe and proper manner, based, again, on input from our medical advisors and based on the science that dictates the next steps. So with that, beautiful day out there. Enjoy the rest of your day. Hopefully the weekend will be a little bit peaceful for you and have time to relax. And with that, onigawahi.
Thank you so much, Lloyd. Lloyd is the Commissioner of Public Safety here in Kahnawake. And it certainly has been a busy week. We hope that people will be able to get to relax. Just a little note again, if you're just tuning in, the water situation is fine. There was an advisory that had been put out there to reduce your consumption. You still shouldn't be wasteful, but at least things are back to normal. Again, we mentioned yesterday Frank McComber from Mohawk Council of Kahnawake. In terms of business, I know some people in the business community still have concerns. He has left his phone number available. You can contact him at any time. His number is 438-830-5049. I'll be off for a few days. Neil McComber, my colleague and good friend, will be coming in for the next few days. And also would like to thank our technical crew, Wenatio Daibo. We also have, of course, Skylar Taylor, Gene Daibo, and our producer, Justice Polson Lahash. We'd like to thank those guys. And we'd like to thank you for joining us. So until next time, stay safe, stay apart, and stay home if you're not feeling well. So take care, and we'll see you next time. We have a couple of interesting programs coming up for you this weekend, so I hope you'll join us. Take care. Onagiwahi.